Alright, so we're going to show how to give yourself a testosterone injection. And so here's all of your supplies. You have your 1 ml syringe. You have your 21 gauge needle, which is a large needle that you're going to use to draw the fluid up. And we need a larger needle because the fluid is thick. But we don't want to inject with this large needle. We want to inject with a tiny needle. So this is our tiny needle we're going to use to inject yourself. Then we have an alcohol prep, and so we'll go through the filling up instructions. And we also need a little needle disposal container that we'll get in just a minute. Okay, so everything peels apart. We peel apart the syringes thusly. We take out our syringe, and your dose is either going to be 0.1 or 0.15. So I'm going to pull the syringe back to 0.1. Okay, so this is 0.1. You'll notice that the plunger is right at 0.1. If we were going to go to 0.15, we would pull it to 0.15, just a little bit further. So either way. But we're going to start you at 0.1. So we pull the syringe back to 0.1, and we want to take as much air as we're going to pull out of the vial. We're going to inject that air in there first to equalize pressure. Because if we keep taking fluid out, and keep taking fluid out, and keep taking fluid out, month after month, we're going to create a vacuum in here, and then it's going to not work properly. So always put as much air in as we're going to take out. So we're going to take out 0.1, so we're going to put 0.1 of air, and we're going to hook it to the larger needle. So let's go ahead and put this together. So I've hooked it together, then I unsheath the big needle, and open up the alcohol prep, and wipe off the top of the syringe. We save the alcohol prep because we're going to use this later to clean your thigh. All right, we put the needle in, right in the middle of the bullseye, and turn it upside down and inject the air in. And then, come closer. What we're going to do is we're just going to pull back until we get a bunch of fluid in the syringe, and then we push it forward until we push all the air out, and we have the plunger up to 0.1. So we put 0.1 of fluid into the syringe. All right, at this point, we take everything out. We remove this needle, and we replace it with the tiny needle that you're going to inject yourself with. Yeah, just screw it together. Perfect, okay? And then pull the needle cap off. Okay, good. No problem. Then this is what you're going to actually inject yourself with. And the injection technique, you want to go perpendicular to the skin. You don't want to go like that. You want to go straight into the skin. And the area that we're going to pick, come over here please, is going to be the lateral thigh here. We don't want to ever go cross the midline, because on the midline there are nerves and arteries and veins we can hit. But if we stay out here on the outside, we're not going to hit anything. And you want to look and see if there's any veins. Like it looks like there might be a little vein here. So we won't go there, but we can go anywhere else. So we'll just sterilize this area here where there's nothing. So we take our alcohol prep, we wipe this area off here. So now the skin is clean. And then we're going to take our syringe like this. So go ahead and hold it in your hand. And don't put your finger up here. Hold it like that. And then just go straight into the skin very quickly. And leave it in. Okay, perfect. Then it's a good idea to pull back and notice that no blood came out. No blood came out. Now you can use your index finger to inject the fluid in. It's all done. Then pull it out quickly. Perfect. All done. How did it feel?
No problem.
No problem at all. Okay, now we need the container for the needles. So we're going to take this needle off, and we're going to take our little needle container that everybody has a copy of, and we drop the needle in here, and we drop the fill needle in here, and then that is collected until such time as you're done with it, and then you bring it back in and we dispose of it for you. And then all of the other things, the empty syringe and the debris, we throw away, and our testosterone we leave just sitting out of the shelf. We don't put it in the refrigerator, because refrigerating it makes it too thick, then we can't use it. Okay, easy enough? So the women's protocol is either 0.1 or 0.15 cc's every 2 weeks. So here's the first of the month, so you'll do it again on the 16th of the month, 15th or 16th of the month, and then again on the first of the month. And then in about 2 or 3 months, we'll want to check a level. And whenever we check the levels of the testosterone in the bloodstream, we always like to do it before your next injection. So right before your next injection is the right time to come in for us to check the level. Okay?
Okay.
Any questions?
No.
Okay. Thank you.